silicone implant, you can cut it right in half and there's nothing to leak out. So that isn't a concern anymore. And that tends to be what we use the majority of with our breast reconstruction patients.
Okay, we're going to take a break, but when we come back, will you actually give us a demonstration of what they look like and how they would, not literally a demonstration of how they would be
Sure.
implanted, but you'll tell us the different options. And also when we come back, we're going to hear from Kimberly, who, as I said, can give us a firsthand account of what some of the challenges are after surviving breast cancer. So you definitely want to hear her story. We'll be right back as It's Your Call continues. Welcome back again, everyone. I'm Lynn Doyle. This is It's Your Call. And as we do this time of the year, every year we're focusing on breast cancer. Our topic today is life after breast cancer, because fortunately more women are living through a cancer diagnosis, and that's the good news. On the other hand, we need you to be prepared for what life might be like for you after you've beaten the cancer, because there are sometimes some obstacles and challenges that you are still facing. One of those comes with reconstruction. Not always, but sometimes, so we're just trying to give you as much information as possible. Dr. William Scarlett specializes in this and has an example for us of the various types of implants that can be used during reconstruction. I just wanted to touch on that a little bit more so that people were more educated about what the options are.
Certainly, when we talk about reconstruction, we kind of break it down into using your own tissue versus using implants. And there's a selective process as to who would make more sense to do one direction or the other. But the majority
you can actually use your own skin or your own tissue.
You can absolutely use some of the tissue from either your abdomen, or you can bring it around from your back, usually with an implant in that case. But you can use your own tissue to reconstruct it.
So you would actually form a breast from your own skin?
Using your own skin and tissue.
Wow. That's amazing.
Now, again, it's a much longer procedure, and you have to fit the criteria, and that there are a number of things that would prevent you from being able to do that. But the majority of the reconstruction that we do in the United States is with implants.
Okay, so you have some examples here. Explain to us the difference between them.
As we were talking about earlier, this is a tissue expander, and this would be put in at the time of the mastectomy, and we would put in as much fluid as we could at the time of surgery. It obviously wouldn't be the size we would want to ultimately achieve.
May I feel
Certainly.
it just to see what you can keep it right there? Okay, so that's soft, kind of jelly. Okay.
A little gritty.
A little gritty, okay. So you put this in
at the
skin
time
that you've stretched.
Well, we put this in at the time of the mastectomy.
Okay.
So after the breast has been removed, we put this in and then close the skin over that. Then when they come back into the office each week, we use this magnet, which tells us right where to put the needle, and we add more salt water to this in order to stretch the skin to get to the size that we would want to achieve.
Okay.
Then this would be removed as an outpatient procedure, and either a saline implant is used, or a silicone implant. Now, this is the silicone implant we were just talking about, that is the gel silicone. This is the one that has been FDA approved and can be cut in half, and there's no liquid in it to be leaking out.
Do you traditionally try to match the woman to the size breast that she had before? Is she trying to mimic what she had, or do some women actually use this opportunity to enhance or decrease their size?
I would say the majority of women either go down in size or up in size. It's the rare woman that wants the exact same size. And it's it's life. If a woman has very large breasts and she has enough skin, we can put an implant in at the same time and do a very nice reconstruction that in the end it looks like they had a breast reduction. And I've had patients whose reconstructions at the end are so good, when they go see their doctors who haven't been taking care of them the whole time, they look at them and say, well, I thought you had mastectomies. And it's very nice for the patients to know that their reconstructions are that good that you can fake out a doctor, so to speak.
You couldn't fake these
That's
two
because they're
out.
good.
I was going to say. Now, as I mentioned earlier, Kimberly Albright was diagnosed at the age of 36, and she received a lumpectomy followed by a double mastectomy. She's joining us now with her story. And Kimberly, let me first say, we are so pleased that your prognosis is good and that you have survived this ordeal. Looking back on it, how do you recall what went through your mind when you were told that you had breast cancer?
The initial was shock. At 36, it wasn't what I thought. normally people hear breast cancer, they think, you know, women in their 50s and 60s, not at, you know, 20s and 30s where women are being developed with it now.
Right.
So it was shock.
And then was there fear or was there anger? What were the following emotions that you experienced?
I think it was a combination of both. More fear because I have 3 children, and I didn't know what my diagnosis, you know, what the outcome was going to be, and anger because why me?
Yeah, I think that's very natural. I think any one of us would have that. Why am I that 1 out of 8 or 1 out of 7, depending on the statistics?
Right.
But fortunately for you, the prognosis was good. It could be treated, correct?
Yes.
First, you had a lumpectomy.
Correct.
And then you had the double mastectomy. At age 36, what was that like to know that you were going to lose your breast?
Fear. That was, as a woman, like you said, your breast is what makes a woman a woman. And to know that I was going to lose them, and they talked about reconstruction, but you don't really know what reconstruction is until you go through it. I mean, you can see that I'm still a woman, but on the inside, it still changes you.
You heard Dr. Dupree say earlier that it's not just the physical aspect of the disease that gets to women, but also the emotional and the mental. Can you relate to that? Can you say, as a breast cancer survivor, that it wasn't just the physical that affected you?
Oh yes, this has changed me. I mean, it's been a full year of a roller coaster ride that has changed me completely. My outlook on life and, everyday living.
Has it changed you for the better?
Yeah, I would say definitely.
I've actually had women on this show tell me that their lives changed for the better after a cancer diagnosis because they didn't take things for granted and they appreciated things, little things, much more so than they had prior to the diagnosis.
Yeah, I don't seem to worry about the small things anymore. I mean, I joke with my husband all the time and say, the roof could fall in right in front of the living room and, oh well, it could be fixed.
Right, it's not cancer.
Right.
Well, you then opted for the reconstruction, and that sounded like we've talked about throughout the show that, oh, okay, now, the cancer is over, I've beaten it. This is a piece of cake. Not so much in your case.
No.
What happened?
I got the expanders placed in. Everything was going good. I had the implants put in, and a week into having the implants put in, I started having complications, and I went actually to see Beth. Dr. Scarlett was away, and I called her right away. She's, that's one thing with them, they're always there.
Yeah, she is on call 24/7. Probably 25/8 is a better way to describe her.
Yeah.
So you called?
I called, and she said, come right in. And I went in, and just her looking at me as a doctor, she knew what she was looking at. And I had emergency surgery. Apparently I developed an infection that put me in the hospital for a week, and I lost my whole implant.
So is this the rare occasion, or does this actually happen from time to time?
It's rare, but it's a known complication. It's a foreign body in the body, and there's lots of different ways that infections can occur, but it's a complication we tell patients about, and although you don't want to be that exceptional patient,
right,
when it happens, recognizing it, treating it, taking care of it, you get back on track. And it's obviously it was a little bit longer of a course for Kim, but we got to be way better friends with her than we had we not been there. But it's something that it just makes you appreciate the fact that there's no perfect situation,
right,
and you go one day at a time, and no matter what comes up, we deal with it.
Okay, and on that note, we are going to deal with a commercial break, but when we come back, we are going to talk about some of the risks that are involved and some of the possible complications that are attached to reconstruction. Not enough to keep you from doing it, you just need to be aware of it. So we'll have that and more of Kimberly's story right after this.